presentation on what we are doing in Leipzig, and Ilona Kai and Sonja Neuser are taking over right after me. Both are residents in our institute and working on different projects related to GRIN, particularly Ilona's project. But I would like to start with one project, yes, on facial recognition. You all know that on all the websites of CureGRIN, the GRIN2B Foundation, and so on, all the parents already shared photographs of their children. So there are loads of photographs around. And these are actually a very good resource for research if we had the consent form to use these photographs. Because what we are doing in Leipzig in the project is we investigate facial photographs. There are basically two algorithms that are quite established. One is face-to-gene, the other one is called Gestalt Matcher. And they work like that. You take a photograph, like a passport photograph. The algorithm looks at different points and measures the distances between the eyes, how long is the nose, how long is the mouth, and so on, and creates a mask of dots. And these are being overlapped with other facial photographs, and then you can see that there are similarities that are syndrome specific, and you can compare the masks of syndrome X with the mask of a syndrome Y, and see whether or not they are similar or not similar. So I don't go into too much details here. Face2Gene is actually also a commercial app. You can download this on your mobile, and you can just take any photograph and drag and drop it to this tool, and then the algorithm calculates what this face looks most likely like. In my example, fortunately, there are only syndromes with very low similarity scores. This one is low to medium, fortunately. I think I do not have any of those. But this obviously works for disorders with a much more recognizable facial gestalt. So this one is a girl with Down syndrome. And Down syndrome is also the first disorder that is being picked by the algorithm with a high similarity score. And the one on place number 2 is already only medium similarity, and then it's getting lower. So it's not perfect, but it's actually working quite well. And it works the better it is trained. And what we did is we thought, would this also work for GRIN disorders? And we collected a few dozen facial photographs of GRIN1 and 2A and 2B, and also of one GRIA4 child. And, and we've seen, yes, actually it does work. So these clouds are the different disorders, GRIN1, GRIN2A, and GRIN2B. And there is some faces that overlap, but also some faces that are different from GRIN2A that is different from GRIN2B. And if you look at a more sophisticated image, then you see here the red peak. These are normal faces. The blue peak are GRIN1 faces. And if you take any other GRIN1 image, then you can see that this orange peak is more in the range of the blue peak, and it's below this black line, which is the threshold. And 50% of this peak should be, no, 75%, sorry, 75%, no, 50%, I was right. 50% should be below this threshold to be differentiable from controls. And you see here that actually in GRIN1, it's 66% below the threshold. So yes, it works. We can differentiate GRIN1 from other faces. For GRIN2A, it's even more and even better to differentiate. And for GRIN2B, it's even a bit better. So for these three faces, it does work. We can differentiate them from control images. We can also differentiate them from each other. So if we look at GRIN1 versus GRIN2A, it should be above the threshold, and it is. GRIN1 versus 2B, it's even better, and GRIN2A versus GRIN2B, it's even better. So these images, a GRIN2A phase is not similar to a GRIN2B phase. So in the end, long story short, we can there are no facial similarities in a 2A phase versus a GRIN1 phase, and so on, and 2A versus 2B, but there are similarities from 2A to 2A, and so on. So what we are doing is we would love to have more photographs to train our algorithm even better. What we need is a simple image of the affected children or adults if they are older, which should be fully just like a passport. And we need a consent form, which can be found on our website. I have this pictogram. If you would like, you can just scan it with your mobile phone, and you go you get forwarded directly to the consent form. And what we aim for is we would like to use this algorithm to identify variants of unknown significance, or to clarify variants of uncertain significance, and help predicting whether they are pathogenic, but also whether they are potential gain or loss of function. Maybe GRIN2A loss of function phases look different from GRIN2A gain of function phases, and maybe GRIN2A gain of function phases are similar to GRIN2B gain of function phases. So far, we have too few images to validate this hypothesis. And and in the end, it actually could also help to predict the outcome, because when we know the functional consequence of the variant, and we know that it's a gain of function, then we often know this is probably a more severe phenotype. Then we can already see from a facial photograph what direction the phenotype will go. Yeah, and that's so far from my part, and Ilona Krai is taking over and is talking about the next topics that are going on in Leipzig.
Yes, thank you, Johannes. I'd like to continue with an update about the GRIN portal, the GRIN registry, and a short update about our GRIN memantine and GRIN1 project. But before I start, I'd like to thank you for the invitation, for having us here, and for all in the audience to still be here. I know it's a long day and a lot of great talks, so thank you for still being here. This picture, you can find it also in the poster hall. This is a QR code of our portal and the registry. Above, you can see the landing page of our portal. But before I tell you more about the portal and the registry, I'd like to introduce you to the team behind the portal and the registry. We are an international and interdisciplinary team of human geneticists, not only Johannes and me from Leipzig. We are a larger group, but these are the pictures that fit it here. We are human geneticists, clinicians, pharmacologists, biostatistics, and we all work together to update, to make the registry and the portal even better. And so the GRIN portal combines genetic, clinical, functional, and research data. I'm not able to show you every section, but we have different sections with like basic informations, educational resources, variant analysis, a research section, then a section with a registry. This could be interesting for you. We have this short video which introduces you to GRIN-related disorders in an easy language. We added additional languages, and And we have a growing number of organizations we are referring to. And this is new. We have a new tutorial. This is also a video, which, for example, shows you how you can find your children's variant in the portal. It also shows you if there are other individuals with the same variant. And if you find this, you can contact us and we can match the families. We can ask the other one. We can look who is the other individual and then give the contacts. So this is something if not, you should try. And this is the section of the registry. So for me, it's very important to let you know that we have one registry. We work together. We share the data. We check for duplicates. But due to data security stuff, we have to host it on 2 different places. So we have one place in Europe, in Leipzig, for Europe, Asia, and Africa. And the other one is in Denver, where Tim Benke is working. And this is for North and South America and Australia. But as I said, we are working together. We are, every month we meet and we try to, right now we try to harmonize the questionnaire because it's still a little bit different. So we try to harmonize the questionnaire. We'd like to add somehow a natural history study. It's not very large. It's more a small natural history study, but we like to ask the parents or the clinicians yearly to add new symptoms or to inform us about changes. And we also cooperate with GRIN Europe to improve the questionnaire because we know it's not perfect and we know that we can add more questions and be more precisely. But yeah, it's ongoing. It's an ongoing project. And if you feel that we miss a very important point, please contact us and we can change the questionnaire at any time. For now, we have more than 1,000 patients in both registries together. And previously, I don't remember exactly the talk, but there was other numbers. In our registry, we have nearly the same for GRIN1, GRIN2A, and GRIN2B, which is interesting from my point of view. We also have some GRIA and GRIC and GRID variants, but the GRIA variants, to be honest, we handle them over to Ellen. So they are still there. We do not delete any data, but if you have GRIA patients or a child with a GRIA variant, Ellen is the better address. So, and it's important that not all of these variants are yet in the portal. We updated it every 2 to 3 months because before we upload it to the portal, we medically validate all the entries. So here we have more than thousands. In the portal, it's around 700. So this is not always the same number. Now a short overview for the GRIN1 project, which is a project I worked a lot the last month. So in the registry and also the published data together, we collected more than 200 individuals with GRIN1 related disorder due to a heterozygous pathogenic missense variant. And in the beginning, we had quite more, but it's very important that you have to make sure that it's really a pathogenic variant according to the ACMG criteria. And therefore, we had to sort out some variants that are not really pathogenic. But these are together are more than 200, and in 100 cases, the functional analysis revealed a gain of function. We cooperate with Emory, so they performed the functional testing. And in 124 cases, we identified a loss of function variants. We had 3 variants that are definitely pathogenic, but we couldn't see a functional effect, and in 7 cases, the functional analysis resulted in an indeterminate effect. This is what Xavi called the orphan variant. So yeah, if you're interested in them, I'm happy to handle these over to you. And we have 17 additional recessive cases with a homozygous or a compound heterozygous variant. And this is the only figure I like to show you. We are writing the paper and hopefully publish all the data soon. So this is unpublished data, but this is only a short overview. But we saw that all of these individuals had a developmental delay or intellectual disability. But what was interesting for us that especially the gain of function had a more severe phenotype. They were more often affected by epilepsy. They were more often, or we saw in more cases, MRI abnormalities. But in contrast, in the loss of function cases, we saw more often these movement disorders, and there's another ongoing study for movement disorders where we also include some of these patients. And the last project I'd like to give you an update is the memantine project, and we functionally analyzed, or not we, the guys from Emory, functionally analyzed 27 variants, and we identified 16 gain of function and 11 loss of function. And this is interesting because some of the published cases, we found out that they are loss of function. So this is because for memantine, the published knowledge isn't that good. We have some cases, but these are single cases, and sometimes it's hard to assess if they really improved or not, or even there wasn't the information if it's functionally tested or not. So we found 16 gain of function, 11 loss of function. And we saw in 60% of the individuals with a gain of function that they had improvements in awareness, alertness, sometimes in sleep patterns, and which was very interesting for us that 50% of the individuals with a gain of function showed a reduction in seizure frequency, which is, I guess, quite a lot. And what makes sense is that only one of the 11 individuals with a loss of function showed improvements, and here was a reduced seizure frequency, and this is indeed a published case. So in total, we see improvements with memantine. We see, but to be honest, we see these improvements sometimes last only for a few months, or the improvements were there, but only slightly. So this is something we have to look deeper into the data. And we think that memantine is a good thing for gain of functions, but not for all of them. And we think that or our hypothesis is that there are a subset of gain of function variants that could improve with the treatment of memantine. And we think that this depends on the localization in the gene, but this is something we need to check now. And this is something we like to finish this year. So in summary, behind the portal and the registry, we are an international and interdisciplinary team. The portal will be updated every 2 to 3 months with new genetic, phenotypic, and functional data. The registry will be harmonized and updated soon. And we are close to finalize the GRIN-1 and the memantine project soon, and hopefully publish by the end of this year or beginning of next year. So maybe next year I can present some more data. And now I'd like to hand over to Sonja.
So, okay, thank you for the introduction, Ilona. And I'm taking over for the third part. My name is Sonja Neusser, and I'm also from Leipzig, obviously. And my main project is about mosaicism in parents of children with de novo variants. And it's not limited to GRIN or GRI disorders, but it is also relevant for the families. So if we have a couple who has a child with a de novo variant and they go to genetic counseling in case they want another child, they are usually counseled with a recurrence probability of 1 to 5%. But this is only on empirical data, so observational studies. In real, the recurrence probability will be between 0% or nearly 0% and 50%. If the de novo variant has arisen in the child, we call it a constitutive de novo variant in the child, so really in the germline of the child, the risk is very low. But there are cases where the variant has arisen already in the parent, in one of the parent. Then it is a case of a post-zygotic mosaicism, not in the child, but in the parent. And there may be affected more tissues in the parent, then we call it a mixed mosaicism, or only in the gonads of one of the parents. And then in both of the cases, the recurrence probability is much higher and maybe up to 50%. So in real, this number is not very true. And for the most families, the recurrence probability is nearly 0%. But for some families, it may be really high, and that is not covered in the routine diagnostic, in the routine genetic diagnosis of a de novo variant. So we have set up a study some years ago, where we get different samples of the parents, so blood sample of the child to have it for comparison and both parents, but we also get a buccal swab and eyebrow hairs of both parents and the semen sample of the father, and this is the most important and most relevant tissue. And as we all know, we are not able to get comparable material from the mothers, obviously. Then we do a deep targeted analysis for this specific variant of the child in both parents, in all tissues. And we phase the variant to the maternal or paternal allele where it has arisen. And for all families who participate in the study, they get an individual report on the study results if they want. So we already have the results from the first cohort, which is nearly 140 families, and we have identified 7 mosaic families or parents. So this is 5%. This is comparable with other smaller studies from the literature. And I have just looked up in the cohort, there's one GRIN2B and one GRIN3B family, but they were not mosaic cases to say. And of the 7 mosaic parents, 2 have been mothers and 5 have been fathers. The second cohort is in progress. It focused mainly on SCN1A, as we had a collaboration with another research group in Germany. But we also have GRIN families in this, and now I'm coming to the third cohort. We are currently recruiting for it, and it's quite easy to take part in the study because you can do everything at home, or the families can do it at home. We send the package to the family, and they can do the tissue sample collection at home and can send it back to us via normal post. And the project is from Rami Abuyamra from Leipzig and me. And if you are more interested to learn about all projects from Leipzig, we have the posters still in the room where we have the dinner tonight, and you can find all project and the QR codes to take part in it. And if you know families or you are a family that is interested in the Mosaic project, you can just write the emails down and send it to me. Thank you for your attention, and I will hand over.